So at this point in time, what you've worked on with your dilators is inserting the dilator and allowing it to be there for a prolonged stretch. Then you've worked on stretches, particularly for the first layer of the pelvic floor and then to the second layer of the pelvic floor. There will come a point in time where we can now skip that first part of inserting the dilator and allowing it to be there because your muscles are no longer guarding. Your central nervous system is clearly okay with a dilator being there. You can just go right to the section of stretching your muscles and then moving on to the next section of the DVD. Move the dilator in and out of your vagina slowly to simulate sex. Make sure you insert the dilator with pressure along the bottom side of the vagina. This way, your muscles are aware of the intention of the dilator to be inserted, versus trying to insert in the middle of the vaginal opening, where the muscles tend to tense in anticipation of the insertion. Increase the speed of the movement as you are comfortable with it. As you go in and out, notice if you feel any places that seem tight or tender. Try to identify on which side you are feeling it and where on that side it's located. Keep your muscles as relaxed as possible, allowing the dilator to move through with ease. Do not allow your muscles to grip the dilator. When you locate a tight or tender spot, stop the in and out movement and focus the dilator pressure on that spot. Angle the dilator to give pressure on that spot. Now you will apply pressure there for 60 to 90 seconds. You will be familiar with this from the vaginal mapping and trigger point release section of the DVD. After 60 to 90 seconds, resume the in and out motion of the dilator. Notice if this spot of tension or tightness feels better, and notice if there are other spots, and then you can repeat the steps. Pause the DVD here until you are ready to move on.